For his self-declared Liberation Day, Donald Trump announced a massive penalty, a 100% tariff placed directly on foreign-made drugs entering the United States. The moment that headline dropped, panic rippled through the Indian stock market. Major pharmaceutical exporters, companies like Sun Pharma and Dr. Reddy, saw their shares slide by up to 4% almost instantly. The reaction makes sense on paper. India is widely known as the pharmacy of the world, exporting massive volumes of medicine to the U.S. A 100% tariff sounds like a lethal blow to a cornerstone of the national economy. But the mainstream panic missed a crucial detail in the fine print. India is not the primary target of this economic hammer. To understand who actually suffers from this trade war, we have to look past the top-line headline and expose the hidden two-tiered system of global medicine. The first tier consists of patented drugs. These are original medications, cures for cancer, specialized treatments for diabetes, where companies spend billions of dollars on research and development. To recover those massive costs, they secure a patent and charge monopoly prices. The second tier is generic drugs. Once a patent expires, the formula becomes public. Companies can then mass-produce identical copies, allowing them to sell the exact same medication for pennies on the dollar and reach millions of people. The global supply chain for these generics is well established. The raw chemical ingredients, known as APIs, are exported from China to India. India then uses those ingredients to manufacture finished generic medicines for the world. When you read the exact wording of Trump's target, he applied the 100% tariff strictly to patented and branded drugs. The cheap, mass-produced generic drugs are completely untouched. Because 90% of India's drug exports fall into that generic category, they dodge the tariff entirely. The catastrophic financial blow will actually land on developed nations like Ireland, Switzerland, and Germany, who control the highly lucrative patented drug market. By focusing on high-volume rather than high-margin patents, India inadvertently created a protective shield against this specific wave of American protectionism. You might be wondering how a president can unilaterally double the cost of life-saving medicine. After all, the U.S. Supreme Court had already blocked Trump from arbitrarily imposing worldwide tariffs earlier in 2026. He utilized a specific legal loophole to bypass the judges entirely. The logic he argued is simple. If a global war breaks out, the United States cannot rely on foreign entities for critical medications. If European companies refuse to sell, Americans suffer. Therefore, the factories must physically exist inside America. By weaponizing the concept of national security, Trump effectively forced wealthy European pharmaceutical giants into a corner. Either pay double the cost to export or pack up and build your factories in the U.S. While the pharma industry was digesting that news, Trump fired a secondary shot at the industrial sector, announcing an aggressive 50%. It is a highly effective backdoor method to tax high-value foreign imports under the guise of protecting domestic metals. This brings us back to India. While 90% of its pharma exports are shielded, the remaining 10% is tied up in contract manufacturing for those foreign patented drugs. That 10% will still suffer heavily, which is exactly what triggered the initial stock market panic. Beyond the pharmacy, the danger facing India's metal industry is immediate. Major players like Tata Steel and Hindustan Copper are now directly caught in the crosshairs of that massive 50% metals tariff. This visualization compares the true economics of the drug trade. India exports massive physical volumes of cheap generic pills for small returns. Meanwhile, Ireland generates a staggering $66 billion in revenue simply by controlling rights to high-value patented drugs. That is the harsh reality check for India's economy. Right now, it functions largely as a low-margin copycat factory. To capture true economic power on the global stage, it urgently needs to invest in homegrown research and development. With Trade War 2.0 officially underway, aggressive protectionism is permanently redrawing global supply chains. The days of easily shipping cheap goods are fading fast. India's generic drug industry may have dodged a fatal blow today, but surviving these increasingly protectionist markets will require evolving from mass imitation to true scientific innovation. If you're looking to adapt and learn new skills for the changing economy, join our Sunday webinar on building websites with AI. The WhatsApp community link is pinned in the comments. Stay sharp, and thanks for watching.